Hello, and thank you for taking the time to watch this lecture on Black health status. The thesis of my talk is that being Black in America is dangerous to our health, to African American health, and that this danger is tied to race and not merely class. And specifically, it's tied to racism. What I hope to do in this short lecture is just establish the fact that there is a significant health disparities between Blacks and whites. To do that, I look at measures, international and national measures of health. I start with the death rate. What is the rate of death per population? This is a common measure of health in which different populations are compared, nations are compared. And the death rate for African Americans is 1,039 per 100,000 population per year. However, the death rate for whites is significantly less, only 797 per 100,000. This leads to an excess death rate of over 87,000 per year, per 100,000 per year. What this means, 87,000 excess deaths per year, not 87,000 per 100,000, but 87,000 per year. Now, excess deaths is a term of art that is used in medical and health disparities. It means that when you take two populations and compare them, you determine what deaths would not have occurred if the population with the highest death rate had the death rate of the population with the lowest death rate. So what this basically says is that over 87,000 deaths of African Americans would not occur every year if African Americans had the same death rates as whites. To put that in perspective, imagine that you load up a jumbo jet with nothing but Black people. How many jumbo jets would have to crash to equal 87,000 deaths per year? Approximately one per day. Think about that. Think about the disasters that we have almost stopped our populations. The New Orleans deaths, the 9/11 deaths. None of them compare to the 87,000 deaths per year that is occurring among African Americans because we do not have the same death rate as whites. Now, another way to look at it, and one that I developed, this is not a standard method in health disparities areas, but another way to think about it is to think about the deaths among whites that do not occur because they have a lower death rate. Because when we talk about health disparities, we always talking about improving the health of African Americans in order to close the gap. Because the goal of health disparities is not merely to improve the health of African Americans. That's being done. The goal of health disparities work is to close the gap between Black and white. And you can close that gap either by raising the health status of African Americans or by lowering the health status of whites. Now, make no mistake, I am not at all advocating for whites to have poorer health. In fact, I think that everyone in America should have better health than what they have. But we do have to acknowledge that the privilege of whiteness has resulted in 500,000 deaths, prevented deaths per year. 500,000 white people get to live because they do not have the death rate that African Americans have. Another way of looking at this is life expectancy. But what I like to do is look at life expectancy and look at that in terms of how we would rate as a country. Approximately 190 countries in the world. Where does the health of white Americans and black Americans stand when compared to countries? Well, one of the things that we should be notice here is that when we talk about life expectancy, white American males do not have the longest life expectancy, and that we actually rank, white American males actually rank quite low among the developed nations, 30th. But when you compare black American males, there is a 7-year gap between white American males and black American males. And that countries like Jamaica, Bahamas, and Barbados all have longer life expectancy than black American males. Now, I particularly picked those countries because we often want to say that it's being poor that is the problem. But in fact, these countries are poorer than Americans. The similar gap exists between white American females and black American females. Now, the gap is not as quite as wide as with males, and and females also live longer than males, but still there is a 4-year gap between white American females and black American females. And we see the same pattern that white American females' health is not very high in the developed world, in the rich countries. And that black American females' health is quite low and ranks among second world, third world country rates. Places like Bosnia that just came out of a war, Barbados, Cuba, the Bahamas, all have higher death rates than black American females. Infant mortality rate is the death rate per 100,000 live births of babies in their first year of life. And again, the same pattern, with white Americans ranked after Cuba at 27 and black Americans ranked after Bahamas at 65. And with the infant mortality rate being almost triple the white American rate. not white, but 13.6 compared to 5.7.